Our presenter today is going to be Lori Peterson. Excuse me. Lori launched collaborative consulting in 2010 on the eve of healthcare system reform when uncertainty prevailed. She understood that the challenge facing health and social care organizations would be reinvention, not preservation of the status quo. Her current project focus is on the design and implementation of cross-sector partnerships, community-based care networks, capacity building programs, and leadership redesign initiatives. Before we get Lori to the floor here, we are going to hear a little bit from Maya from N4A, who's going to talk a little bit about the program. Welcome, Maya.
Great. Thank you so much, and good afternoon, everyone. My name is Maya Optebeke, and I'm the program manager at N4A's Aging and Disability Business Institute. And as Steve said before I introduced Lori, I wanted to provide you all a brief background on the N4A Trailblazers Learning Collaborative that worked with Lori in creating the tools that she's going to detail on this webinar. So for those of you who don't know, at the Business Institute, our mission is to successfully build and strengthen partnerships between community-based organizations and the healthcare system, so that older adults and people with disabilities have access to services and supports that they need that enable them to live successfully in their homes and communities for as long as possible. So as part of our work, with a grant from the Administration on Community Living, ACL, that focused on building business acumen skills, we brought together advanced CBOs from across the country to participate in the development of resources and tools that provide comprehensive strategies for approaching and engaging with different healthcare payers and providers. So members of this learning collaborative shared their experiences and expertise from their own contracting efforts in the field, which helped inform the many products and tools that are to come out of this work as a whole. The Trailblazers were split into two working groups, one that focused on strategies for approaching health plans, and the second one being focused on approaching health systems. And Lori worked closely with the health systems work group to develop the 4 partnership readiness assessment tools that she will talk about momentarily. The Learning Collaborative has been working together for the past 30 months as part of the grant, and it's actually coming to a close at the end of this month. So I can share that the tools will be available publicly on our website later this fall, and we really encourage everyone to go to our website at www.aginganddisabilitybusinessinstitute.org to sign up for our email list so that you all are the first ones to know when the tools have actually been launched. And before I wrap up, I'll say after this presentation, if you have any N4A specific questions for the Business Institute, please feel free to email us at businessinstitute@n4a.org. And with that very brief background, I will now turn things over to Lori to present on the tools. And thank you, Lori, for doing all this work with us.
Yeah, no, thank you, Maya, and thank you, Steve. And good morning and or good afternoon to everybody who's participating on the webinar today. So this summer, I attended an all-day conference hosted by Modern Healthcare with the topic on the social determinants of health. Now, in hearing myself say this, I think I have to pause for a moment and acknowledge that if we were doing this exact webinar probably 3 to 4 years ago, I couldn't have led with that opening sentence, because it would have been highly unlikely that Modern Healthcare, which is a source for covering healthcare business, policy, and research news, would be hosting a full-day conference with many more to come on their agenda on the social determinants of health. So I think that points to a signal of how perceptions of what defines health and healthcare are changing and progressing. But my whole point about bringing this up was that one of the speakers at the conference caught my attention. And he was talking about for any policy change to occur, 3 ingredients need to exist. 1, evidence, 2, strategy, and 3, will. Now, thinking about this some more, if I just remove the word policy this is a similar framework for any significant change, whether that change is taking place in the marketplace, individual or organizational change. So let's take, for example, the changes that are often required to pursue, implement, sustain, and grow partnerships with healthcare organizations. And many of you on this webinar have experiential understanding of these changes. You need to have evidence or a rationale that the market dynamics and the emerging trends are producing corresponding partnership opportunities for your organization. You need to have a strong and yet fluid strategy to activate the change and position for opportunity. And you need to have the will to go through the organizational changes, including learning about a new sector, developing new skills and capabilities, and deploying new processes and practices that are needed to sustain your efforts. And just, I would say, the right amount of organizational grit to make those changes stick. Now, some of you might be thinking at this point, hey, I came to a webinar to talk about CBO tools. What is this woman talking about? So here's the connection that I'm going to make to the tools. And if you don't remember really anything about the tools in this webinar, please remember this point. So the tools and the processes that are embedded in the use of the tools can absolutely help you with that first ingredient, evidence. So using some of the tools I'm going to talk about and incorporating the practices within the tools can help you better understand the market, identify and vet new opportunities, and produce the rationale for pursuing partnerships or not. The second ingredient, strategy. The information and the insight that you can gain by utilizing some of the processes within the tools, as well as going through some of the questions that are peppered throughout the tools to help stimulate strategic thinking, can absolutely help you inform your healthcare partnership strategy. But the third one, the third ingredient, will, and organizational grit, as I like to say, is completely up to you. So there isn't a tool, and there isn't any, in fact, a capacity building program or a resource or a webinar that can produce the desire and the determination that's needed to really navigate through the change initiative that's required in creating partnerships with healthcare organizations. So I know that was a kind of a long and windy way to get to my disclaimer about the tools. So let's go ahead and dive in here. And the rest of my time will be spent talking a little bit about the process that we went through, a little bit about each one of the tools, and then I'll talk a little bit about where we currently are, and then take some questions. So the slide that you're looking at right now is a process that we have found, basically let's say it's a framework, that we have found to be useful in thinking about what is required, what work is required and needed for preparing your organization for partnerships, and actually beyond preparing, but for designing, implementing, sustaining and growing your healthcare partnership strategy. And within this, you can see that there's phases of work all the way from internal assessment to external to model design to business development to the partnership. And within each one of these phases, you can see, I would say, there's kind of task level work that needs to be done. But what you don't see is within each of these tasks, there's certain new learning capabilities and competencies that also need to take place. So, for example, if you look at the external assessment, there are a variety of tasks, including conducting a market assessment, understanding the marketplace, identifying opportunities, assessing your competitors, etc., which is one level. But to do that and sustain it, there actually needs to be the ability to apply foresight, to take the information that you gain through those tasks and turn it into meaningful and valuable insight, and to be able to start to forecast the different changes, market dynamics, and trends that are actually going to create opportunity for partnership development. So as we've been doing our work with CBOs and capacity building and the creation of partnerships, we have looked at this process, and then we've been talking and thinking, and you can see there's a whole list here around how could we create some tools or some resources that would actually help organizations go through the process, go through the work categories, but then develop skills, capabilities for the long haul. So we've been keeping, as you can see, this is a very long list. We've been keeping a list. Really, it's a kind of a portfolio of tools and resources along the way. Some of these are in ideation phase, some of them are partially developed, and then some of them, like the four I'm going to talk to you about in just a moment, are fully functional and ready to go. So I want to talk just a little bit about the process that we went through with the Trailblazers Learning Collaborative. And the reason being is that this process, we really didn't want it to be just a group of consultants trying to put theory into action, but we wanted it to be a process that included multiple perspectives, and especially the perspectives of CBOs that have really been on the forefront of cross-sector partnering, but also to incorporate perspective of the CBOs that might be at just the beginning stages and or the middle stages. The other piece, so we went through a pretty hefty discovery phase, and I'm going to talk a little bit more about that in just a moment. But the other piece that was very important was the design and test. So each member of the collaborative was assigned a couple, either one, maybe even more tools to actually test out. So we wanted them to go through the entire tool, test it, and then give us feedback so we could redefine and basically redesign some of the functionality of the tools. And the reason being is because the primary intent was to design these four tools that will actually be utilized, and not something that CBOs would be like, oh, yeah, this looks great, makes a lot of sense, but I really don't have time to go through the entire process. So we went through the design phase, and thank you to all the collaborative members who actually tested them out. And then where we are right now is basically the finalization of them and distribution of the tools like Maya talked about. So the discovery phase. As I said, it was very important for us to understand firsthand partnership development experience of the CBOs. And we were very interested in understanding what they know now, but didn't know when they started their partnership journey. And could that learning be transferred to process development and practice development that could help other CBOs? So we did interviews and very much focused on what was their partnership journey. We also were very interested in understanding what organizational functions were developed as they were implementing partnerships and pursuing and growing, designing, and sustaining them. So we were interested, did certain functions actually develop along the way, like business development? Did new operational and or service delivery functions develop? And how were those practices and processes put into place, but more importantly, how were they sustained? So oftentimes when I'm talking to community-based organizations and I'm talking about, well, I'm asking about their experience in developing partnerships, they'll go, oh yeah, well we were, building the plane while we were flying it. Which, by the way, is never something that I've resonated much with, but probably because I fly a lot. But if you dig a little bit deeper, there are actually processes, there are certain practices that formed along the way that can be very transferable and helpful to other community-based organizations that are starting this work. So we wanted to understand that, and we wanted to understand the different stages of partnership development, and we wanted to understand what might improve, accelerate, or advance their current partnerships, regardless of what stage they were in. So here are a few things that came out of the discovery phase, and these were basically folks saying, here's what we would like to be able to achieve by utilization of certain tools, which are really, processes and practices embedded into the tool. And a big one landed on the ability to identify and understand partnership opportunities, to understand and then be able to respond to the competition, which I'm sure many of you are well aware as more emphasis gets put on the social determinants, and more attention and more investment, more competition is starting to emerge. How do you develop a compelling case for partnership? How do you start to overcome and build how do you overcome the build versus buy? Now, I want to pause here and make a point, especially on this build versus buy issue. So the tools are not designed to spit out a strategy for how you go about overcoming that particular objection. However, if you use the tools and go through the process, you should gain the insight that can help you design narrative, design a case to overcome some of these objections. So I just wanted to make it clear that some of these opportunities, the tool doesn't actually do. You actually still have to do it. The tool processes and questions embedded are designed to help you get there. So out of that, here are the top 4 that came to the top. And as you can see, there were about 7 that we were considering. But after we went through the discovery phase and we assessed all of that material, after we went through a bit of research around what was on the public domain, because another big goal of this process was not to duplicate. So we did not want to go out and create more tools and resources if they were already in existence. And then there was also quite a bit of research on just in general what are best practices of a competitor analysis, for example. So there was a combination of experiential input and research. And then what came out of that process is the 4 tools that were considered high priority. And that doesn't mean that number 5, number 6, and number 7 won't eventually get developed, but these are the 4 that we started with: external assessment, a competitor assessment and analysis tool, an opportunity assessment, and then building the business case. So just a quick snapshot of the purpose of each tool, and then I'll talk a little bit about the functionality, and then Steve, we're probably going to have plenty of time for questions because I'm moving through the content pretty quickly here. So first, the external assessment, and so the purpose of this tool is to help organizations go through what I would call a pretty in-depth assessment of their marketplace, mostly at the local level, but it does incorporate understanding at the national and state level as well, with the intent to be able to identify and understand, number 1, what are the emerging market trends, number 2, what are who in the healthcare marketplace is engaged, who are your potential partners, what are they doing, and then how do you start to create strategies to attract and generate interest from those healthcare organizations. So I'll talk a little bit about the steps in that tool, but in general, that's the purpose for the external assessment. The competitor analysis, I think, is pretty straightforward, but there's numerous tabs and numerous steps in the use of this tool that looks at pretty much traditional practices around how you would assess your competitors. There's a focus within this particular tool on not only looking at your traditional set of competitors, but who might be your new competitors, including those entities that you might once have considered potential partners or potential purchasers of your services that are now starting to think about building on their own. And then there's a whole set of questions to guide you through the process around how you would compare your organization and the strengths of your organization to your competitors. So very, very traditional, but we very much have embedded the information within the tools to be specific to healthcare, a healthcare strategy or a healthcare partnership strategy, I should say. And then the purpose of the opportunity assessment. So what we have seen is that it's a better position to actually think about your opportunities and be proactive in prioritizing what opportunities to go for, which, by the way, should become very clear once you go through the external assessment, instead of just being in a position of where you're responding and reacting to the different opportunities that might be coming across your desk. So this particular tool really helps an organization assess the opportunities or potential opportunities and then prioritize and rank them based upon a set of criteria that you establish. So we did not establish the criteria within the tool, but it offers a template and an exercise for you to think about how to prioritize which opportunities are most important to you based upon the criteria that you design. And then building the business case, I think this is pretty straightforward what the actual purpose of this tool is. And I can tell you with all the work that we've done in CBO capacity building initiatives, this continues to be an area that can use constant improvement and is constantly changing. So we have incorporated lots of different resources within this tool because, again, there is information on the public domain. There are different tools around building the business and the financial case on the public domain. So we made sure to incorporate any of those existing resources that we could get our hands on. All right, so the tool, the functionality piece. So let me just say before I get into each one, which I've already touched on a little bit, but I'll try to go down to one more level here. But before I say that, I want to say all the tools have a certain aspects, characteristics, and functionality. So, for example, there's an overview and introduction around why even consider using the tool, like why even conduct an assessment. So each tool has a bit of a why you might even consider using it. Each tool includes instructions, and basically the instructions are step by step how to go through the process. And then it takes it one more level actually and talks about the task for each step in the process. So the instructions were designed to be very, very straightforward, but also thinking about this as steps and process and tasks within those steps and processes. Each tool has additional resources to supplement the tool. So there's links to articles, there's links to webinars, there's links to other tools like the ROI calculator that was designed by Victor Tabush for the Commonwealth Fund. There's links to databases that are available on the public domain. So every tool has additional resources built in it. Also, each tool has different stages, and right now the tools are in Excel, and so you can see each tab is a different stage that guides the user or the users through the steps in the process. So, for example, let's just take the external market assessment here. So Step one might be identifying the organizations that you want to assess, identifying the healthcare organizations that you want to assess. Step two looks like identifying market-wide activity. So what are some of the MA plans doing? What are some of your local hospitals participating in value-based initiatives? What are some of the post-acute players doing, et cetera? The step three provides a template for actually taking each organization and drilling down in much more detail. There's a step four, which looks at the possibility of exploring additional resources. And then step five is a set of what I would call critical thinking questions that help you start to synthesize the information and make meaning out of the information, because the aim is not to just dump a bunch of information into a tool, but to actually work with it. So that brings me to one of the things that every tool also has is a set of synthesis-oriented questions to help you start to think about, now how do I utilize all of this information that I've just gathered to populate the templates within the tools. Let's see. Oh, and then finally, each tool also has recommendations for process development. So this was a very important aspect in the design phase that came up over and over with the CBOs that we worked with to design these tools. And that was to help an organization start to think about, how do I create process, so, and or I should say accountability for turning the practices into an ongoing, I shouldn't say practice, but basically what I'm trying to say here is how do we help create process so that some of the tasks within the tools get incorporated in the long term. So the aim is not to do a competitor assessment as a one-off, but to do it and to do it in depth, but then create a practice of where you're doing it on an ongoing basis and you're collecting the information and utilizing the information on an ongoing basis. So each of the tools has a couple suggestions on ongoing process development for these particular areas. All right, and so, oh, and then one other thing, and then I'll just bullet point these very quickly. So then each tool has a template for gathering and collecting data. So again, not meant to be static, not meant to be a thing that you collect a bunch of information once, have it sit in a tool and that's that, but that you're able to collect the information and then update it as needed. So very quickly, the external assessment, I think I've talked pretty much already around the steps involved, everything that's involved in the tool, everything that I mentioned is in the tool. The competitor analysis, so basically you've got the identification and the overview of potential competitors, and there's a template to collect that information. There's navigation through the process of not only identification of those competitors, but how do we actually analyze them, and how do we analyze them against our own strengths and our own areas for improvement. There's some examples on how to respond, and then there's again a set of questions to address. All right, so the opportunity assessment, I've already talked about this, but I'll very quickly, there's the template for an internal assessment. So that's basically looking at where does our organization currently have strengths, where might we start to utilize that strength to create partnerships. The external assessment piece, which should be basically converted from utilizing the external tool, a guide for synthesizing that information, and then the scoring and ranking, which I'll just say again, you create the criteria, but then there's there's some programming within the tool that helps you populate, and then you'll get to see where your opportunities rank in priority. And then building the case for partnership, this tool is probably from a back-end perspective is the most complex because there's quite a bit of programming in identifying your costs, your volume, potential pricing. There's worksheets for identifying and kind of working through, okay, what kind of impact do we want to have? There's ability to start to think about how you want to create the narrative around that business case, who you might target, and then again, additional resources. So I would say out of all the tools, this one probably has the most complexity on the back end. But that's one other thing I'll say across all the tools is that we try to make them as simple as possible, but that doesn't necessarily mean that it's easy to go through the process of collecting all the information and then utilizing that information. So, all right, so I've been talking very quickly here. Just to close this part out, and then I will take some questions. Steve, like I said, I'm a little bit ahead of schedule here. But basically, after we went through the process, designed the tools, we were interested just to see where in the partnership readiness process and/or framework did the majority of the need land. And so if you look at this in red, you can see that there's still quite a bit of need on the external assessment side, and likely because that's the area that you know rapidly changes and evolves, and keeping up on that, keeping up is an ongoing process. And so many of the tools were designed, the opportunity assessment, the competitor assessment, the market assessment, really in this external assessment phase of work. And then not surprising either, and I mentioned this at the beginning, the model design, which we've kind of captured building the business case within this particular section of work. Huge need, continues to be a need, continues to change and need more and more support in kind of getting very clear around what is the case for investing in your services and intervention. And then the last one in the prioritization and targeting of opportunities falling in the business development section. So that was just a way for us to kind of look back and give some feedback around, all right, we've gone through the process, we've worked with these individuals, we've designed the tools, so where is this kind of falling within that whole realm of readiness? And so as Maya mentioned, here's where we are. We're finalizing the tools, which, by the way, they are finalized in Excel version. So if anybody's interested in testing them in the Excel format, they're ready to go. However, as Maya mentioned, N4A is putting them on their website, so they will be available soon via a web version. And then we will be thinking about how to get them more widely distributed. Last but not least, you can't really see this, but I tried to give a quick visual here of the competitor assessment and analysis, just so you could put maybe some of what I've been saying into context visually. This is only one of the tabs, and again, I can see it's kind of hard to see, but that's just basically an example. And so with that, Steve, I will turn it over to you, and if there are any questions, I'm happy to take those at this point.
Okay, great. Thanks a lot, Lori. Yes, everyone, we have plenty of time for questions, so please send in your questions at this time using the questions and answer box that you can see there on your screen, and we will pose them to Lori as we get started moving into the Q&A portion here. And okay, first question for you, Lori. Here it is. Is it typical that these partnerships are started as part of a structured process or is this something that can be initiated individually with proposals?
Love the question. Thank you. And I probably should have mentioned this. Part of the discovery phase was to also think about with community-based organizations in how they went about designing partnerships when it was more of a structured opportunity and or let's say it was more of a mandate by the state compared to a marketplace that perhaps there wasn't a lot of reform activity happening, and basically community-based organizations were put in the position to, I'd say, to lead and to try to generate interest from the healthcare sector. And really, I would say much more of a business development and sales strategy was needed. So the tools are designed very much for, yes, if you've got activity that's being mandated, but two, I would say much more in the realm of how might a community-based organization that believes there's opportunity in their marketplace to create partnership, how might they go about doing that? So I'm not sure I'm getting exactly at the question, but that was definitely part of our design phase and part of the discovery phase, I should say, of the design process.
Okay, thank you. Next question. How important is it to have consumer with lived experience involved in this partnership development process? I'm not really sure I understand that question. There might be some issue with the verbiage of that. So if you could send that back in with a little bit of clarification, that would be helpful. And so as we're waiting on that next one for you, Lori.
Steve?
Is it? Yes.
So I will respond on what I think that question might be getting at, but
okay, sure.
if I'm wrong, please have the individual correct me.
Super, no, have at
it. All right. So what I think the question is about is the beneficiary of a partnership, which ultimately, when we're talking about cross-sector partnership, we're talking about the integration between the medical sector and the social sector, which hypothetically should create more integration around the way care and services are delivered. And the beneficiary is the consumer or client or patient, however you identify with those individuals that you serve. And bringing that beneficiary into the partnership design process on the front end, whenever possible, I think absolutely will add value, and especially value in the sustainability of the partnership. So it doesn't probably happen enough, but I think it's an incredibly valuable strategy and should be happening more. So Steve, again, not sure I got it, but I think that's what the question is circling around.
Okay, great, thank you. Yes, and if that was not exactly what you were looking for, you can send that question in for clarification if you want to. Next question here, Lori, moving along. Is it intended that the CBO toolkit be used by organizations in a self-guided way or in partnership with a consultant?
Well, that person knows they're asking a consultant, right? So I might be a little bit biased in my response. But I will say they are intended to be utilized without assistance from a consultant. We have used tools and the tools like this, like I showed you in one of those first visuals. We've used them in our work with community-based organizations, and it's often very helpful to have some guidance, especially if these are particular practices that you've not gone through, or maybe you've gone through them with your traditional operations, but maybe not necessarily as you think about creating alliances, partnership, collaboration, contracts with healthcare organizations. So The guidance is nice, but they're not designed to have any kind of consultant participation.
All right, thank you. And yes, so that other question was clarified. You did actually get that one on the nose, so thank you.
Oh, good, good. A great question.
Okay, so earlier in the presentation, you were talking about the partnership readiness process, and from what was on the screen, it seemed a rather extensive proposition, as it should be. The question is, along the way, have you had to sort of get some of your partnerships in better shape and say, you know, you're kind of not really doing it here, and you got to give them some feedback and get them back on the right track? Has that happened, and how have you handled those situations?
Okay, I'm not sure I'm completely following, so let me take a shot, and again, if I'm not, Steve, please have the individual correct and/or clarify for me. But any partnership, because if you think about just the nature of partnering, you're talking about a whole host of, one thing we don't have up here in this readiness process is a whole host of human dynamics. And it's great to go through the process of designing partnerships and readying an organization and implementing and so on. But it really does come down to, I think, the human dynamics that can either really accelerate the process and or completely derail it. So any good partnership has good partnering components and philosophies embedded in it. And so therefore, yes, stepping back and looking at your current partnerships, are they working? What's not working about them? Is partnership even the right strategy for your organization? I mean, that's a very worthy question to grapple with, even if you're in current partnerships and or if you're thinking about expanding them or if you're just at the beginning stages. So part of the last phase that we talk a little bit, or that we in this particular framework, again, it's just a framework. This is not a linear step-by-step by any stretch. But in this last phase where we're talking about the partnership and really looking at it from an experimentation point of view, and being able to step back, reflect, evaluate, refine, come back to the partnership and refine and rework what didn't work, and then determine what makes sense to expand, replicate, grow. So yes, definitely an important part of the process. Steve, again, I may have went on a little bit of a ramble on that one, so if I didn't get it, just call me out here.
Totally fine. Okay, so talk a little bit more about that, about the process of examining these partnerships. How often do you do that? Do you kind of do it on an ad hoc basis as needed? Do you do it every 6 months, or how exactly do you look at that to see how it's working, and how do you adjust for that?
Well, I would say a couple things. Depending on the way the partnership was established on the front end would also depend on the timing and the frequency of how you're going to evaluate the partnership. So let's say, for example, it was a 6-month pilot. And we do see a lot of this. You see, hey, I healthcare organization, I know I need to start thinking about these non-clinical aspects, and I want to do this through partnership, but I'm only willing to do a 6-month pilot to test it out. So often within the front-end design of a partnership, I would recommend that you build in checkpoints for evaluation. So that's a perfect example of at month 3. If this is a 6-month thing, at month 3, you clearly would want to be understanding, is the intent of the partnership playing out? Are we achieving the results that we intended? And so, the partnership is a means to an end. It's not the end. And so is this partnership actually producing what we thought it would produce? If not, how do we make changes? If so, how do we build on it? And then other times where you think about evaluation of partnership, it's clearly when something's not working, and not just thinking it'll work itself out, but putting some real intention around how you evaluate the success or the not success of the partnership. The other piece I'll say very quickly is building in on the front end. Very important, and I'm sure people, if you're not multitasking and you're listening, I've said front end of partnering very often in this discussion, but is to build in on the front end, how do you work through conflict, and how do you work through areas that don't end up working out like you thought they would in the beginning, and talking and actually creating some guidelines for that on the front end will be very helpful if it actually transpires.
Okay, thank you, Lori. And since we all, everybody likes to hear the dirt, please let us talk about how some of these partnerships have not worked and how you have responded to these challenges.
Oh boy, well, me personally, I'm not actually the individual that has to respond. It's typically the community-based organization and the healthcare organization that are in the partnership. So we have definitely been on, the ancillary of that, and I would say if I have to just, kind of throw a dart here without thinking about this in a lot of depth, most of the challenges are because of the design on the front end wasn't well thought out. And I think what happens is individuals they get kind of, if you just look at your personal partnerships, it's easy to get caught up in the chemistry of a new beginning. And then just wanting to jump in and get started and see what happens. And then when things go off course a little bit, there's not any platform and or structure around how to work through those challenges. So again, I would say if I have to look back, and we've been doing this a while, most of the challenges and the problems could have been avoided, not all, but a big handful of them if there was better design on the front end. So Steve, again, that's kind of a loaded question, and of course, since I'm not the one in the partnership, I'm basically giving my response from a bit of an ancillary perspective.
Sure.
I can tell you that there's lots of community-based organizations that have experiential understanding of that dynamic and could probably speak very freely about it.
Okay. So talk about how that looks, Lori, setting things up better on the front end so that you're not in these unfortunate situations.
So who's ever asking that question, if they shoot me an email, I will actually send a framework that we have about around designing and evaluating cross-sector partnerships. Because it in and of itself would probably be an entire webinar. So happy to send that. We actually just distributed it recently, but it talks a little bit about how the design on the front end, but it also has some really strong elements of monitoring and evaluating cross-sector partnerships. So who's ever asking that question, please do send me an email and I'll make sure to get that in your hands.
Great. And yes, everyone, you can see Lori's contact information up there on the screen if you want it. No need to furiously write it down because it is in the slides that you can download over on your left, and that will also be sent to you later on today, so that her contact information will be in there for you. Okay, Lori, getting back to the questions here. Earlier, kind of at the top of the presentation, you were talking about the discovery phase, doing interviews and things like that, and some of the primary challenges in partnership development for those just starting in the process. Can you elaborate on that a little bit more? Talk about what some of those challenges have been that you've seen and how they have been worked out over time.
Yeah, and what we were trying to do in the discovery phase is to basically take a sampling of challenges that community-based organizations have gone through, and then think about, okay, could we actually learn from those challenges? Could we convert some of those challenges into processes and practices that could help other CBOs basically sidestep some of that? So that's what we were, if I'm thinking about the discovery phase at the beginning of this particular webinar, that's what we were really after, is to try to capture some of those challenges that community-based organizations had in their partnership development process and capture it into the tool with the intent of helping others. So for example, with the market assessment, I'm just going to take the market assessment tool. Something that we heard quite a bit is that, yeah, you know, I kind of understood the market. I had a sense of what was happening. I collected some information, and then I just kind of went out there and tried to make it happen. So one challenge in that we found is, okay, that's not very comprehensive. And often what happens with that approach is one might spend a lot of time, energy targeting a particular partner, but not having really the backup information around why they're targeting that particular partner. So part of the market assessment tool was to say, okay, how do you build in resource, database, and questions that would actually help an organization understand their marketplace in more depth, and therefore with that understanding they could actually do a better job in targeting potential healthcare organizations, and with that targeting they could do a better job in prioritization, which everyone is usually trying to do this work, and at the same time they're trying to maximize their current business. So it's incredibly challenging to say, okay, I need to maximize my current business and at the same time I need to launch a healthcare strategy, or I want to launch a healthcare strategy that requires new learning and skill development and so on. So the ability to prioritize and make that prioritization as informed as possible based upon what's happening in your marketplace is really important. So Steve, that's just one example where we heard a challenge, we tried to take that challenge, and we tried to build in certain functionality or aspects of the tool that would help an organization address some of those challenges on the front end, opposed to, you know, getting in and going, oh, wow, I really wish I would have done a better job in evaluating the marketplace. So again, kind of went on a ramble, but that answer or that question could be an entire discussion in and of itself, but that's one example of a challenge we identified in the discovery phase and how we tried to get at that challenge in the tool design and development phase.
Okay, thank you. Okay, next question, Lori. Could that framework be shared with everyone? Sounds very helpful. We were talking about that just a little bit ago.
Oh, sure. Yeah, Steve, I can send it to you.
Okay, yeah, please do so, and we can send it out to everyone. That'd be great. Earlier in the presentation, Lori, you were talking about the discovery phase, and it seemed like a lot of analysis that you have to do before you jump into the pool, so to speak. I heard a couple of the key phrases, but are you doing the traditional SWOT analyses on these in the discovery phase?
Well, in the discovery phase was the process that we went through with the Trailblazers Learning Collaborative to get the information we needed to help us design the tool. In the competitor assessment and analysis, there is some traditional practices around identification of strength, weakness, opportunity, and threat. It's not exactly laid out in that way, but anybody who spends some time and goes through the tool, they'll start to recognize some of those practices. So within the competitor analysis, yes. So I think I mentioned part of, I'll just say very quickly because now I'm aware that now we're running out of time, but part of the aim of the tool was not to recreate anything. And so basically, if there were practices out there, we tried to incorporate them into the tool. What we did try to do, however, is to design them in a way that was specific to a community-based organization that was trying to launch, create, sustain, grow partnerships with healthcare. Although, quite frankly, many of these are transferable into numerous other areas beyond partnering.
Okay. Lori, it sounds like there's a lot of detailed work that goes into doing these partnerships, and it seems like that communication skills would be an absolute must for keeping things on track. Can you talk a little bit about that and how important that is to the overall process?
Well, which part? Are we talking about the detailed work that's involved? Are we talking about communication? And are we talking about communication internally, or are we talking about communication and narrative externally? A little bit of everything?
Yeah, a little bit of everything, if you could just touch on some of it.
Steve, will you just say the question one more time, and within the couple minutes I have, I'll try to get the key point there.
Yeah, so the question is that it seems like communication is a very key skill for keeping these partnerships on track, and so can you talk about how important that is to the overall process?
Yes. And this speaks to part of the last tab of every tool. I talked a little bit about it as process development, but really you could also look at it as a way to keep communication going internally. So for example, let's say that you're going to tackle the market assessment. You probably want to have a bit of a plan around, well, who within your team is going to do what, and how are you going to bring that information back to each other? How are you going to work with that information? And how are you going to utilize the information? And all of that requires a pretty significant amount of communication internally, and I'm not even talking yet about your communication externally. But the lack of communication and/or the very little communication also ends up being one of the biggest challenges around sustainability of partnership. And so somebody asked earlier about some of those challenges, or I think somebody called it the dark side of partnering. I mean, we could pretty much put that in, communication as one of those big vortex areas. So, Steve, I don't think I did a great job answering that question because it's pretty full, and I'm happy to have a conversation with that individual after because I know we're out of time.
Oh, no, totally fine, Lori. But yes, as you mentioned, it is time for us to wrap up here, and we've reached the end of our hour. But Lori, I want to thank you for joining us for today's presentation. Thanks so much.
Yes, thanks everyone. Have a good rest of the week.